Welcome. Thank you so much for joining us. I'm Jeff Miller. I'm one of the co-directors of Grand Rounds. I'm joined today via the Zoom webinar by Kate Elkington, another co-director, and Christine Denny is our third. I'll just make a quick pitch. You may have seen an email announcement that Simon can put in. Hopefully, we'll send you the text, Simon, to put it in the chat. Again, that we are seeking the next generation of Grand Rounds co-directors. So if you're interested, it's a great opportunity to meet other members of the department and leaders of our field internationally. So I'd encourage you to apply. A few quick additional announcements. Our new interim chair and interim director, Dr. Jeremy Veenstra Vanderweel, will be hosting a town hall that we hope you could join us for this Friday, July 28th at 11 a.m. The town hall will be hybrid, both in person and via Zoom, and additional details about that town hall will be sent out this afternoon. It's open to everyone, and we encourage you to join in person. Next, we normally take a break from Grand Rounds in August, but we will have one additional Grand Rounds next week on August 2nd before going on break, a special Grand Rounds that we hope you can join us for as well. That will also be in person, but at a different location. And I'm going to share screen and put this in present. Oh, let's see. Okay. Because we're beginning some AV updates to the auditorium, next week's Grand Rounds will be in the Vagelos Education Center, just up the street at 104 Haven Ave, at 171st Street in the main auditorium there in room 201. Next week's speaker will be Dr. Nadine Melham, Associate Professor of Psychiatry and Director of the Program for the Neurobiology of Stress Response and Suicide at the University of Pittsburgh School of Medicine. The title of her talk is Clinical and Biological Phenotyping for Suicidal Behavior in Youth. So we hope you can join us there at that alternate location. In terms of today's session, I want to encourage everyone to ask questions at the end of the session. For those on the Zoom, you can do so using the Q&A feature at the bottom of the window. If you're a trainee, please put the word trainee at the beginning of your question. We will prioritize trainee questions both on the Zoom and among our in-person attendees. Also, if you're a Zoom attendee, we would encourage you to ask your question yourself. Please, in your question, write, "Can ask question myself," or prefer to have question read. We'll promote you temporarily to a panelist on the webinar if you are open to asking the question yourself. Okay, I'm now going to pass things over to Dr. Veenstra Vanderweel to introduce Dr. Patrice Malone.
Great, thank you so much, Jeff. Can you give me a thumbs up if you can hear me? Great, super. So I would encourage people to join next week. Would just note that it is a spectacular setting for folks who haven't been in that auditorium. And it looks also like it will be a spectacular talk. So for those who haven't met me, I'm Jeremy Veenstra Vanderweel. As you can tell, my last name is challenging, and Jeff said it perfectly. You're welcome to call me Jeremy or Dr. V in the future. I regret not being in person for this first Grand Rounds in this role, both because it would be nice to be there and because this particular Grand Rounds, I think, is going to be truly special. I've gotten the opportunity to know Kevin Simon through the research committee of the American Academy of Child and Adolescent Psychiatry. And when we think about the framing of our department, certainly we think about our clinical training, research missions, but we also think about our community orientation, and his ability to speak to that specifically in his role as now the new Chief Behavioral Health Officer in the city of Boston, I think will be really wonderful to hear. I am pleased to introduce, and this is in some ways a cascading introduction, Patrice Malone, who I think is familiar to most. Patrice obviously is the director of the June Jackson Christmas Summer Program, and we'll share with you some about that program. This Grand Rounds also recognizes Dr. Christmas and recognizes that program. I think that this is the first time Patrice is in front of us in her new role as the Diversity, Equity, Inclusion Director of Clinical Services for both Columbia Doctors and the New York Presbyterian Hospital-based Clinical Services, and also in her role as Assistant Director of the Division of Child and Adolescent Psychiatry. So really nice to welcome Patrice to those roles. And, you know, I think a round of applause for that is in order, and I'll pause briefly for that. I'm also, I should just say, pleased to recognize that Patrice has served for some time as the co-chair of the Diversity and Inclusion Alliance, a really wonderful initiative within our clinical services, is also an attending at the Smithers Clinic and an assistant professor here. So really pleased to hand things off to Patrice for the introduction.
Thank you so much, Jeremy, and good morning, everyone. This is, of course, a very special event for me, the annual Dr. June Jackson Christmas Program Grand Rounds. Thank you all for being here, both in person and virtually. I will say that in 2016, when I started the JJC program, it certainly was a passion project, and it's wonderful to see that it has continued. So the program started with a 5-week clinical experience during the summer for rising second-year medical students from underrepresented groups in medicine, with the hope of encouraging them to choose a career in psychiatry by exposing them early on in their medical school training to the breadth of what the profession of psychiatry has to offer. In 2017, we added a research experience, an 8-week research experience for exposure to behavioral health research. And then in 2021, Dr. Nicole Pacheco spearheaded a month-long sub-I for 4th-year medical students from underrepresented groups in medicine with the focus on community psychiatry. And Dr. Jade Avery, a recent graduate of our residency program, led the 4th-year elective as part of her APA SAMHSA fellowship last year. We are so super excited that there are 3 JJC, prior JJC fellows that are now residents in our psychiatry training programs. At 99 years young, this is the first summer since the inception of the program that Dr. Christmas has been unable to meet with the students and join us. She sends her well wishes to all of us. Dr. Christmas is an African-American pioneering community psychiatrist who founded the Harlem Rehabilitation Center, an innovative community-based psychiatric program which trained local Harlem residents to assist psychiatric inpatients with re-entry into society. She worked as the Commissioner of Mental Health and Mental Retardation Services of New York City, and later as a member of Governor Mario Cuomo's Advisory Committee on Black Affairs. She also taught and supervised our trainees here at Columbia for many years. Traditionally, the Dr. June Jackson Christmas Program Grand Rounds has really been an event to highlight the change makers in our community that are working to improve access, increase knowledge, and destigmatize mental health illness, especially for historically minoritized populations. Speakers have included Dr. Alpha Stewart, the first African-American president of the APA, and Dr. Carl Hart, the first tenured African-American professor of sciences here at Columbia University. I believe that this year's speaker really is in line with those pioneering efforts of other presenters for the JJC Grand Rounds. I'm gonna have Dr. Chiamaka Ezie, a current PGY3 in our residency program, and who is also leading the JJC 4th-year elective this summer for this year, to introduce Dr. Kevin Simon. Thank you all.
Good morning, all. It's an honor to be here, both to represent the June Jackson Christmas Program and to introduce our very exciting speaker. My name is Chiamaka Ezie. Again, I'm a PGY3 here in the psychiatry program, and lovely to be here. So without further delay, we'll talk about Dr. Simon. Kevin Simon, MD, MPH, is Boston's inaugural Chief Behavioral Health Officer, appointed by Mayor Michelle Wu. He leads a citywide public health strategy to meet Boston's growing behavioral health needs through the Boston Public Health Commission. Dr. Simon is an academic psychiatrist, a healthcare policy expert, and a noted teacher and writer. He is a pediatric and adult psychiatrist and addiction medicine specialist at Boston Children's Hospital, an instructor at Harvard Medical School, a recent Commonwealth Fund Fellow in Health Policy at Harvard University, and the medical director of Wayside Youth and Family Support Network. Clinically, he cares for youth and families through the Adolescent Substance Use and Addiction Program at Boston Children's Hospital. Academically, he has secured multiple federal awards for research on structural violence, health inequity, and mental health, including the American Academy of Child and Adolescent Psychiatry, or ACAP, Physician Scientist Specialist in Substance Use K-12 Career Development Award, funded by the National Institute on Drug Abuse, or NIDA. As medical director, he oversaw the planning and implementation of a community behavioral health center funded by the Massachusetts Department of Mental Health. Dr. Simon also consults on mental health system design and provides expert opinions to federal agencies reviewing healthcare practices. His writings on health inequity are in notable journals like the American Journal of Public Health and the New England Journal of Medicine. National audiences regularly seek his perspectives on mental health through trusted outlets. We're very lucky to be just such an audience today. So without further ado, I'd like to bring him up to the podium and welcome Dr. Simon.
Thank you, Chiemeka. Simon. Would this work? Okay. All right. So thank you all for inviting me here. Do we have the June Jackson students here? Can y'all stand up? So this is like a homecoming because I'm from Brooklyn, New York. And is Ryan here? Ryan Sultan? Not here yet? All right, he's a colleague. And Jeremy, I forgive you for not being here. Karen Cruz, who organizes, I think, the department, it's like, do you want to meet people? I said, well, I know my colleagues. I said, yeah, Jeremy would be one person. Like, oh, he's busy. I'm like, he's busy. I'm like, we're all busy. I didn't realize why he's busy. So congratulations to Jeremy in his new role. So I'm going to talk about safeguarding a city's mental health. And in terms of disclosures, I don't have any financial disclosures. There may be many emotional disclosures that occur. But we're going to talk about background, in part, why are you listening to me right now, right? Chiemeka read a nice bio that I wrote. But really, I think I should introduce my family, career path, particularly thinking about the students that are here, mentors, meeting the mayor, and how am I in the position that I'm in, talking about the state of behavioral health crisis that you all are very familiar with, and thinking about what is it that we're doing in Boston, let alone what can be done in New York City in reference to mitigating or moving in the right direction. Is that Ryan? See, I called you out and you weren't here. And talking about future directions. And so before I'm Chief Behavioral Health Officer, I have a background. So my parents are from Haiti. My mom is from Gonaïve and my dad is from Bas-en-Bleu. And does anyone know why Gonaïve is important? No. See, this is why I love learning environments, because there's always something to learn. So Gonaïve is actually the epicenter of the revolt for Haiti in 1804. And if you met my mom, you'd understand why people from Gonaïve would be the type of people to lead a revolt. But in 68 and 69, they didn't know each other, but they had foresight, or their parents had foresight to send them to United States. Where? To Brooklyn, which is where I come in. And so that's me and my parents in front of 1662 Troy Avenue. They still live in the same house that I grew up in. Before me, there were two other people that they had. My sisters, Michelle's to my right. She's a nurse practitioner at one of our cousin institutions, NYU Bellevue. And then Natasha, she's a nurse anesthetist, she's in Georgia. And we always stand in the same orientation. And my dad, he's notable, Deacon Mauclair Simon. He's actually the first African-American deacon in the Archdiocese for the city of New York. And my mom, Lady, she's awesome. She has been working for Verizon, which used to be called 9X, which used to be called Bell Atlantic, which used to be called Bell South for 54 years. And I'm like, Mommy, I'm not gonna work any place for 54 years. But I have, that's my nuclear family. I have a new kind of family. That's my wife, Dr. Halford. She's an internist, hospitalist at Beth Israel. She says hi to you all. And sometimes we're able to get dressed up. A lot of times we can't because of these two people, my kids. That's Brooke, 4 going on 24, and KJ. So that's my family. And that's like who I am. And so that undergirds the kind of response and training that I have. Like this infuses all that I learn about. So career trajectory, this is like a smattering of what Chiemeka read to you all. So I went to Morgan State University, that's at HBCU, and I'm mentioning that intentionally because institutions like here and training programs can find really good talented people at historically Black colleges and universities. So Morgan's in Baltimore. I was an ABA, or an applied behavioral analyst therapist, for a year, my senior year. Migrated to the Midwest to go to SIU, small little school in the land of Lincoln. Did research between my 3rd and 4th year. I took an NIMH year to go to Pittsburgh, where I really got keenly interested in health services and looking at systems. In McKeesport of Pennsylvania, they actually had the first nurse practitioner residency program, which now is burgeoning in other cities. I do teach in terms of, Simon, I'm gonna do something here. I'm gonna get a laser for those who are, yes, for those who are attending virtually. I did my adult residency training at Grady. I guess would be equivocal to the Bellevue here. And there I got paired with David Satcher, Glenda Wren at the Kennedy Satcher Center for Mental Health Equity. Again, looking at how our systems impact the patients that do get to us. But as all you know, most of our psychiatric conditions begin well before adulthood. And so I went to Boston Children's Hospital to get training in adult psychiatry. The subpopulation of patients that I particularly have interest in are those who look like me and are youth. And how do you get funding without saying that you want to directly help African-American males and females? Well, you maybe get training in addiction medicine, which I did at Children's, and you say you want to help individuals that are justice involved, because unfortunately there's an overrepresentation of people that look like me in the justice involved system, and oftentimes they do have quote unquote co-occurring dual diagnoses. And so I have, yes, fellowships and funding. The most important thing here for people that are high school students, when I'm talking to them, is this, like MBA. So yeah, I consult to the National Basketball Players Association, which is the players union. And Wayside is a community agency that medical direct. And I've done some consulting, and it's the consulting part that actually has helped me in the role that I'm currently in that we're at Columbia. I'm sure there are many emails that say calls for applications, right? For people who have research interests. In the public sector, there are calls for proposals or calls for applications from nonprofit organizations when a city or a state has funding. And so you can actually help consulting firms respond to municipalities. And so I've done that in other states and other cities. And because child psychiatry is in such dire need, I've moonlighted a lot of places. So all these clinical privileges are places that I provide service to. So I technically am all these things. However, what I'd like to say is that I identify as a learner. In part, wherever I am, literally wherever I am, there's an opportunity to learn something. And so whether I'm at a church or at a nonprofit or at an unhoused center, patients are always giving me things to learn. And I think that's a frame that we should all kind of take when we're engaging with patients or engaging in systems. So be a learner. In terms of mentors and sponsors, because nothing that I'm saying to you is actually generally like original thought from me. It's hybridization of individuals that have helped me along the way. These are my mentors and sponsors. And so classic, I might say, well, how many did you think I had? People always undershoot, so I just stopped asking the question. And what I hope you see here is diversity of mentorship and sponsorship, in part because it's impossible to get to anywhere trying to only find people that look like me, be my mentors or sponsors, right? And so in undergrad at an HBCU, well, yeah, I had persons that look like me. And actually Errol Fields, who's now an associate professor, adolescent medicine at Hopkins, he was a med student at the time. I was like, MD, PhD, you're like too super smart for me. But he like played basketball and did normal things. I was like, oh, wait a minute, he's kind of like me. Then I went to the Midwest. No one liked me. And that's okay. Herbert Chen, who's now the chair of surgery at UAB, I had cold emailed all these departments because you got to get research in. And he responded. And he's like, well, what do you want to get? He was at Wisconsin at the time. And I said, whatever other students do, I'll do too. And I went there for a summer and certainly doing Western blot and pipetting, not what I thought I was going to be doing. I thought it'd be in the surgical suite, not at all. But he said, oh, you know, I think you could make something of this in a career. And he's somewhat right. And interesting enough, now his son's at Yale, interested in psychiatry. Jeff Bennett, clerkship director, and he's the first person that said, Kevin, I think you might want to think about psychiatry. I was like, what are you talking about, Jeff? But I love the way that he made formulations, and he had a neurodevelopmental clinic where people would come in averbal, but he could look and really observe and see and make a really beautiful formulation as to what was actually happening. This is David Coco, Chip Reynolds. These are individuals at Pittsburgh. Chip had a very robust research department where I'd come in and ask a question, and like 6 weeks later, in addition to writing, I'm like a first author. I'm like, this is not how it works. And Carol Pointer, she's actually the first person that said, Kevin, I think you should be in Boston. I was like, what are you talking about? She was a lawyer doing health policy. So, you know, people took interest in me, and I didn't, because they didn't look like me, say, oh, I'm not gonna hang out with them. And then adult psychiatry in Atlanta, right? In Wakanda. Everyone kind of looks like me, right? So Ruth Shim, Glenda Wren, and Zinga Harrison, Daniel Dawes, author of The Political Determinants of Health, Ruth Shim, author of The Social Determinants of Mental Health, right? You always have to see how is it, at least for me, I'm interested in what happens outside, because the reality is the clinical environment, inpatient, outpatient, is just about 10% of someone's like actual engagement, right? So health happens outside of our walls. And then fellowship, leadership, you just have to be willing and wanting to say, I don't understand, so I'm gonna ask a question. And so I have a lot of people that I get to pose questions to, and they've been very helpful to me. And I do have to highlight Basola Ojikutu, who's the commissioner for public health in Boston. And interesting that I mentioned the Commonwealth Fund Fellowship. Well, Basola was also a Commonwealth Fund Fellow in '02. And this person right here, Monica Burrell, was also a Commonwealth Fund Fellow, and she was the commissioner for the state of Massachusetts. And so sometimes you do leadership fellowships and training, yes, for the training, but then also for the network. And so hopefully to the students, you'll want to do a Commonwealth Fund Fellowship in a couple of years. So now I want to highlight a mentee, in part because now I'm in the stage where I get mentees. And some of you know this person. It's Francois Williams. And he was a med student. He's like, Kevin, I'm interested in psychiatry. It's like, are you sure? It's like, yeah. So he's like, the APA has a grant, Helping Hands grant. Like, Francois, I'm busy. I'm a resident. If you come up with the plan, I can help you, but you got to come up with it. And so what did he do? He came up with it, right? Working in barbershop, right? Doing blood pressure, talking about mental health. So the funding gets people free haircuts and a free conversation with a psychiatrist who's talking about anxiety or depression or any other number of activities that people have. And what's interesting is, and we wouldn't have known this at the time, what did he do? He presented this, I think last year, right? So you never really know who you're helping out and how it's gonna impact. So he actually spoke here before I did. So, you know, now Mayor Wu, yes, you can. Look at this. And currently, so Francois did adult psychiatry at Baylor, and now he's doing child psychiatry in DC. I don't want to get it wrong by saying George Washington, but it'd be Georgetown, but it's in DC. So Mayor Wu, so yeah, last year, spring, I meet her and she says, Kevin, can you help Boston? Now you all know where I'm from. I'm like, do I have to like the Red Sox, right? And I don't, so I can help Boston, yes. And so she really wanted to understand my perspective on health, particularly mental health, youth mental health. And so let's talk about that. So let's pivot, right? So if I said to this fabulous audience, what is the state of youth behavioral health? What would you say? You can shout out. This is like an engaging conversation that we're having. What would someone say? What would the June Jackson Fellows say? The state of behavioral health for youth. Any words are allowed. Not good, yes. Crisis, wait list, disorganized, overwhelmed, overworked. I'm waiting for this front row to say something.
To me, it's like a pandemic that actually peaked a long time ago and is just staying really high. And now we've accepted an endemic level as just being like, okay, like, I mean, it's like we're not even, it's like, this was such a problem years ago. It's just been this way.
Yeah.
And it just gets worse.
Yeah. So to June Jackson Fellows, do you want to go into child psychiatry? We'll see. So Ryan is highlighting that this is what it is, right? Right. Long wait list, yeah, that's fine. People can't get it, it's fine, right? The house has been burning for quite some time. So our national organizations, including hospital organizations, yes, stated in 2021 that there's a true actual national crisis. And what's interesting is, and this is where being a historian and a learner is very important, right? Let's read this together. Forward, the burden of suffering experienced by children with mental health needs and their families has created a health crisis in this country. Growing numbers of children are suffering needlessly because their emotional, behavioral, and developmental needs are not being met by those very institutions which were explicitly created to care for them. It is time that we as a nation took seriously the task of preventing mental health problems and treating mental illness in youth. To the audience, when was this written? This is a learning environment, so you can shout, answers can be wrong. Pre-pandemic, 50 years ago. Okay. So it was in 2000. The report of the Surgeon General Conference on Children's Mental Health. That was the Surgeon General, David Satcher, 16th one. Interesting enough, current Surgeon General has written, in essence, the same thing, right? So it's important to have context. And so what are we actually doing to mitigate this crisis? And what does it actually look like? And again, this is for the learners that are in the room. So yes, 1 in 5 youth will experience a psychiatric disorder within the past year, 1/3, unfortunately, within their lifetime. Half of these conditions, yes, happen in adolescence, yet less than half actually get treatment. And so what ends up happening, there's this like 10-year plus delay from the onset of symptoms to actual treatment. And so what does this then look like today? So at Boston Children's Hospital, yes, we have a rising number of people who are boarding, i.e. needing high level of care, yet we don't have the space or capacity, so that they just sit idly in our emergency room or on the medical floor. So now, that's the state of youth behavioral health, poor, wait list. So if I said, oh, well, what's the state of behavioral health for youth of color? Well, what would now be the adjectives that you would use? All of them would be worse, unfortunately. And so here I pause and pivot to show normative individuals of color, in part because a lot of times we're referencing people who are not engaging in things that are normative. And so, yes, this is just what youth should be doing: engage, learning, sometimes dancing on chairs, rocking cool clothes, Jordan 6s, right? And becoming Miss USA, right? These are the things that should be happening. Now we're gonna look at some narrative, and the narrative that I'm going to pull from is Ta-Nehisi Coates' Between the World and Me. If you haven't read it, you should read it. You should make it a part of a journal club, potentially in the training program. So we're gonna take some quotes. I am not a cynic. I love you, and I love the world, and I love it more with every new inch I discover. But you are a Black boy, and you must be responsible for your body in a way that other boys cannot know. So Coates here is writing to his son. But this particular quote, what is he talking about? This idea of being responsible for your body in ways that others don't know. What is he talking about? And again, I'm trying to be engaging here, so you can just shout answers at me. What's the theme here?
Perceptions around aggression.
Perceptions around aggression. Other themes? Police brutality. Other themes? Being perceived as not important. These are all correct. And what's interesting is when I read this, right, more so than any other training I had, when I read this resonates with me. Because as an attending, and as psychiatrists, we don't classically wear white coats, but as an attending, I myself have been told, hey, Dr. Simon, we got to talk to you. I'm like, oh, what happened? Oh, well, you offended someone or did something to someone. I'm like, I did? Like, and most people who know me know that I try to be relatively jovial, because I try to be very cognizant of being a 6'2" African-American male in my role. And so he's very accurate to his son to say, you need to pay attention. Because even for the role that I have, people don't see, oh, the director, da-da-da. They see 6'2" Black male. So let's go to the evidence. So I'm gonna always tether narrative with evidence. So this is Matt Faddis, and I highlight Matt in part because Matt does not look like me, and it's keenly important that it's not only individuals who look like me that are concerned about these types of issues. So they looked at the ABCD study, and what did they do? Surveyed nearly 12,000 parents who had kids between 9 and 10 and said, hey, in the last year, did your child, again, 9, 10-year-old, did your child have like in-school disciplinary action? And unfortunately, what happens when we look? So 5.4% of children receive some detention or suspension. Again, 9, 10-year-olds. And what do we see? Controlling for typical predictors of behavior. Black, multiracial Black children, up to 3.5 times more likely to receive an in-school suspension or detention. And I can tell you, 9, 10-year-olds, let alone 21-year-olds, we don't really behave differently because melanin, right? But the system views our behavior very differently. There's another study from the Yale Child Study Center that I could highlight it here, that they looked at preschool and kindergartens. I don't show it because my kids are in preschool and kindergarten. And there, teachers, Black, white, who do they kind of zone in on? Black youth, Black male youth, right? Again, my son, who's 2, yes, chocolate drop, he's cute now. And people said, oh, he looks just like you. But when he goes to school, and he's in 1st grade, and he still looks just like me, the perception will be different. And unfortunately, I see that in clinic, right? So back to the narrative. I feared not just the violence of this world, but the rules designed to protect you from it. The rules that would have you contort your body to address the block, and contort again to be taken seriously by colleagues, and contort again, so not to give them a reason. What is the theme that he's talking about here? There's a word. Code switching, yes. This idea of needing to change who you are. So that's like when you're talking to the student who has dreads and you tell him to cut it off for interviews, right? You're telling him to be something else than who he is. So do we see that in our systems? So who's this? Anybody know? There's silence in the audience. Cornelius Frederick. Now, how old is Cornelius? Anyone can take a guess. This is a learning environment. 16 years old in this picture. And this picture is in a behavioral health facility. And why was he physically restrained in this behavioral health facility? Was he A, being physically aggressive, cursing the milieu staff, throwing food, threatening a peer, posturing? Why was he physically restrained? And it's one of these answers. And so you can shout A, B, C, D, C. So someone said D. So interesting enough, right? So student, what year? Second year medical student, right? He understands, well, restraint doesn't seem appropriate, but maybe he's threatening a peer, right? Like that's a logical direction, right? Yet you heard individuals who are here who have been trained in our system, and what did they say? C, and they're correct, right? The illogical conclusion is what we all know to say, right? So you have to understand that to try to change the system. Now, how long was he restrained? 1 minute, 10 minutes, an hour, 10 hours? It's one of these answers. Some are saying D. You really? So, students, B. So, again, students, you're thinking about the logical answer, right? And think about this. Just before, You thought logically. The audience thought illogically and said, C, throwing food. 16-year-old in a behavioral health facility in a cafeteria, well, yeah, food might be thrown, right? In terms of the restraint, so it was 10 minutes. Now, what's interesting is, and this is happening right now, there are people who are like, oh my God, thank God it's 10 minutes, right? Because they defaulted to an hour. And Ryan, my good friend, said, I'm hoping it's 10 minutes. I am hoping that a kid who threw a bologna sandwich gets 10 minutes. One minute's too long. 10 minutes can be deadly. Now, is this an aberration? Let's go to the evidence. Physical restraint. Colleagues from Yale looked at nearly 600,000 pediatric emergency room visits. Said, let's identify use of physical restraint, soft cuff restraint. And of the nearly 600,000, it was really 559,000. They found 529 accounts of physical restraint use, right? So it's a very rare event. So rare, it's 0.1% of the time is a physical restraint seemingly deemed necessary in a pediatric emergency room visit, right? 0.1% of the time. Yet, when we can then control for factors, who is then overrepresented in the use of having an order of physical restraint? Adolescent male, African-American, public insurance, right? So I'm in the school system and my normative behavior might get me suspended. I'm in a behavioral health facility where I'm supposed to quote unquote get help. And my normative behavior, adolescents throw food. It's like supposed to happen. Can get me killed. And you say, is this really that concerning? Is it true? Well, historically, the image on your right-hand side, there are intentions of shackling and restraining people. So are those tropes still present today? Yeah, they are. Well, what about pharmacologic restraint? Right, using medication management to quell the person down. So what did we do? Colleagues at Children's Hospital looked at nearly 400,000 pediatric emergency room visits to identify pharmacologic restraint. And when you controlled for factors, who is it again? 18 to 21-year-old, so an older adolescent, male, African-American descent, public insurance, right? So now what's interesting here is there's a feeling that you're having, like, am I participating in this? Well, unfortunately, we all are. And Haldol here, advertised in AJP in 1970, cooperation often begins with Haldol, a first choice for starting therapy. And who is it that they utilize to suggest it needs cooperation? I would suggest that this characterization is someone who may have melanin skin. And so what is the common cocktail that's utilized? Even today, likely someone yesterday got Haldol, Ativan, Cogent, right? Like, it's what we do. And we're almost sometimes aimlessly doing it, not recognizing that we're participating in the disparity that we suggest needs to shift. So let's go to the narrative again. Black people love their children with a kind of obsession. You are all we have, and you come to us endangered. So thinking about youth, this is from colleagues at NYU, suicide and Black boys. Now, what's keen here, look at the age. And so I tell fellows, when you hear the chief complaint, you gotta pay attention. Because one would argue, 5 to 11-year-old, what exactly is happening in your environment that you believe or may feel a decision to take your life, even if it's impulsive, is the better decision than living the life that you're in. But what did I just show you? That the life that they're in, be it in school, be it with providers who are supposed to care for them, leads to certain things. So where am I supposed to go? Where psychologically am I supposed to turn to? Now, I know there's some psychoanalytical folks here, and so Winnicott talks about this idea of creativity, and that you should not be necessarily concerned for the schizophrenic who's throwing feces on the wall. They're trying to engage with their life. They're trying to engage with their environment. But the person who is somnolent, the person who is quiet, the person who is despondent about their environment, oh, that's the person that you need to be paying attention to. So something happened in 2000 and has been going on that I can't explain. And so then we get these patients in the emergency room, right? If I were to ask you about you seeing this, well, what do you think is the method in which individuals who are 5 to 11 are utilizing to commit suicide? One might think, oh, pills, maybe even firearm. It's important to know the age range. Because if I said adolescent, you might be correct in saying firearm. But 5 to 11, well, what do they have access to? The bed sheet, their t-shirt. So yes, hanging, suffocation, self-asphyxiation. But I've had colleagues who heard bed sheet and might have let the person go. I said, oh, no, that's the person we got to pay attention to. Now, what about suicide in Black girls? And so this is Chelsea Christ. She was Miss USA and 30 years old, completed suicide. So from 03 to 17, yeah, look, there's been a significant uptick, particularly girls 15 to 17 years old, African-American, in terms of mental health challenges leading to suicide attempts. And so all that I'm talking about here, you could try to look at them individually, piecemeal. But I think it's important for us to think holistically about the social determinants. What are all these factors that are leading to individuals to experience the world the way that they do, such that when they get to us, sometimes we're a part of it, unfortunately, they have bad outcomes. And so we could do this one by one, but I know we are on time, so, right? At ACEs, unequal access to transportation. There's somebody who has a clinic here, and a person likely wants to get to you, but my God, it will be challenging to get to you. Even virtually. I've had patients Zoom in, it's the great grandma who's the guardian. She might be on like 2G network. And we'll just say his name's Kevin. Where's Kevin? Oh, he doesn't want to show up. Where is he? He's in the back room. Okay. And so I might look up where this person lives. And I've done this on occasion. Students don't do this. And had a patient who was 1.5 miles away, unable to make it physically, nor did he want to log in. I said, well, ma'am, can I come to your house? Well, when? I mean, now we have 40 minutes. You're just a mile and a half away. Are you sure? I'd really like to see Kevin, so yes. And I go 1.5 miles away, down Huntington Avenue. Make a right, 2 blocks. Knock. Oh my gosh, you're here? Yes, ma'am. Where is he? In the back. And sure enough, he's in the back. Got a blanket over his head. I can tell there's been cannabis usage. And we're talking 10 minutes. And I'm looking at my clock. I'm like, okay, hey, Kevin, I gotta, make it back. Because there's somebody else who will show up. Can I see you next week in clinic? I swear to you, he says, I gotta check my schedule. And I said, I was like, what? Excuse my language. What fucking schedule? I'm like, you don't go to school, you're getting high. What are you talking about? I'm gonna check. And the next week he didn't come. But 3 weeks later, I get an email from our admin. Dr. Simon, Kevin wants to see you, but only you. Well, why? Because I went to him, right? We suggest meet patients where they are. Are we actually doing that? So all of these dynamics here are playing out right now in Queens and Brooklyn and Bronx, right? Our patients have poor choices. And so if you give people poor choices, it's going to make poor options, poor choices. Yet we often look at the choices people are making and make judgments about them. But why do they have the poor choice, right? Got to go back, and that leads to these adverse outcomes. You got to go upstream, looking at the policies. And so across my training, yes, I've had fellowships and research fellowships, and I write. And I was talking to a colleague earlier today. I said, I don't have 1,000 publications. And there's somebody in this institution who likely, God bless them, has 500 publications. But I do choose to publish in high, quote unquote, impact journals, right? That can hopefully shift the field, make people pay attention, because the things that we're experiencing, that you're experiencing here, others are experiencing too, in Iowa, in Texas. And so let's think and pivot towards Boston's opportunity. So in 2021, the city secured ARPA funding, American Rescue Plan Act funding. And a subset of that was for behavioral health. And so having understanding of research funding, having understanding of consulting, responding to RFPs, understanding the public sector, private sector, academic center, Basola, the mayor, said, Kevin, we think that this is something that you could help with. And I can tell you that while I'm here now, there were people who were like, Kevin, what are you doing? Why would you're on a good track. I'm like, what track are you talking about? I mean, you're publishing, man, you got a K award. I'm like, what are we talking about? I was like, oh, this is the damn ivory tower thing. So yeah, I'm comfortable, nice reclining chair, typing away. Patient comes in, they don't give 2 F's about where I'm publishing. I'm like, I want to have impact. I think that this could have an impact. And certain people, some of the mentors that you saw, said, Kevin, if this is something that you want to do, you should go pursue it. But there were people in the institution that would question, like, what? Public, what is this? So you got to have your why, not someone else's why, your why. And so what are we doing?
We still need to do more to tackle the issue of youth mental health. Our young people don't just deserve better, they need it right now. And we need them. Last year, we appointed the City of Boston's first ever Chief Behavioral Health Officer, Dr. Kevin Simone, and created the Center for Behavioral Health and Wellness at the Boston Public Health Commission, led by Dr. Samara Grossman. It's not just about those struggling with mental health, but for the many of us who love and care for people who are living with mental health challenges as well. We simply do not have enough mental health providers to meet our city's needs. So in the coming weeks, we'll be announcing new partnerships to train more and more diverse, community-based mental health workers to fill our ranks. A big portion of those will be mental health clinicians, and we're also looking to train more non-clinical workers as well, peer specialists, recovery coaches, and more. We'll support 200 Boston residents pursuing careers in behavioral health, placing the folks we train in neighborhoods across our city, with a particular focus on youth and communities of color, LGBTQ+ communities, immigrant and historically marginalized communities. When we talk about wraparound supports, this is what we mean. Addressing the issue at every level, from specialized clinical care to the people our kids interact with every day, to how we talk about mental health in our daily lives. We're known internationally for our standard of healthcare here in Boston, and that standard should extend to mental health care as well.
And so we have a Center for Behavioral Health and Wellness, and you can think of this as an academic think tank of sorts, but for the city. And this is the team. So what is it that we do, right? So this idea of developing and implementing a comprehensive behavioral health plan. Like, where do you start? So this is actually what we do. So the city has departments within the Public Health Commission, Child and Family, EMS, so our 911 service operates out of the commission. Recovery services, right? So substance use challenges operates at the commission. Then there's this huge big circle, other city departments that I now have conversations with them at the table with the Boston Police Department and Chief of Police, Michael Cox, Mary Skipper, Superintendent of the Boston Public School, right? Large school system, 125 schools, 60,000 students, right? We know that mental and behavioral health and the social determinants of our field exists everywhere. And so I was telling Shamika earlier, I feel like a CL for the city. In part, I engage with this different systems to help them think about it. So for instance, our Boston Public Library, well, where do unhoused persons go when the shelters close? Because the shelters need to get cleaned. Sometimes they show up at the library. Well, librarians are not equipped to help navigate someone that might have a mental health need, but a social worker might be able to. So we put a social worker in the Copley Library. That's our largest library. And what do we find? It's used. So what's going to happen? Expanding that into the other libraries. So there are ways that our expertise can help cities. So we meet with a lot of people. And there are things called community health CHIPS, community health needs assessment, community health implementation plans that we looked at. The last 3 years, behavioral health is at the top 3. Increasing the number of diverse workers. So what are we going to do? Well, yes, we're going to write an RFP, but we're going to make sure that it's publicized, because oftentimes I call RFPs, they're dying in limbo because no one knows that these things exist. And so what did we do? Publicize it. $5 million funding, and she highlighted it. So we have one of our public universities is going to support 200 Boston residents who to pursue careers in behavioral health, licensed mental health clinicians, licensed clinical social workers, peer support services, therapeutic mentors. Fund it fully, support them while they pursue their internship and training. Classically, we wait till people are out of school, yet the issue is we need more people that are diverse getting into the program. So you got to fund it up front. And where did I get this idea from? There's something called a Kalamazoo project. Given time, I'm not going to explain it, but you should look it up, Kalamazoo project. So that you don't have to recreate the wheel, but you got to make sure the wheel is operating smoothly. And we have another partner from the community where there will be highly trained clinicians, psychiatric nurse practitioners, child psychiatrists, and we're going to have them be embedded into some of our Boston public schools, right? So you got to see the connections. Well, what about public awareness? Well, a lot of times we will say we're doing things in the community and not have it in the language that the community understands. And so you're basically not talking to anybody. I can't go to East Flatbush, Afro diaspora, Haitian community, and only have a flyer on the right-hand side or on your left-hand side, right? It has to be also in Haitian Creole. So we ensure that anything that we do, we make sure it's in all 12 languages that are predominant in our city. I go on the radio show of the guy who's the local guy that the community pays attention to. Where some people are like, well, why are you going there? Because people listen to Java Jimmy. And there are services that we have, there's services that you all have, but do people know how to access them? What to access? So yes, we sometimes create social media posts to say, oh, 988, this is why you'd use it. The best team, this is why you would call, right? Behavioral helpline, something that the state initiated, this is why you would call. Because these things exist, yet people don't know that they exist. And so we also have another RFP, and this one we just awarded to recipients to target communication efforts. Because it makes no difference that Jeremy is a super duper genius, your new chair, super duper genius in autism and neurodevelopmental conditions, if no one knows he's doing the work, right? And I can tell you that for his trial, he likely wants to recruit people that look like me. Well, Jeremy, I'm challenging him here. Are you ensuring that the recruitment efforts and the communication efforts are such available to the actual communities that you want people from? You can't keep just putting in the byline of the conclusion. One of the challenges that we've had is that we did not recruit diverse enough, right? Can't keep doing that. Providing youth with pro-social engagement. So I was invited to Chez Vous. It's a roller rink skate. This is it. And it was told to me it was going to be family night, and we're good on time. Awesome. It was going to be family night. It was actually adolescent night, but I brought my 4-year-old, and that was okay. And kids were there, and I'm going to lose some of you here. When they played Just Wanna Rock by Little Uzi Vert, that just went over many people. You'll hear it in a second. The kids, there are about 150 of them, African Caribbean kids, Black, beautiful kids, teenagers, hear Just Wanna Rock, and they just started rocking. No violence. And while I'm here, irrespective of my position, while I'm here, I'm thinking, this is therapeutic. And I'm like, I gotta write about this. But now I don't wanna write about it necessarily in the New England Journal of Medicine. I will. But, the Globe. People in Boston that are funders, read the Globe. I'm gonna publish it there. And so what did that look like? What did it sound like? Again, you gotta, students, wherever you go, your eyes as a psychiatrist, they are your gift. You have to observe. So this is what it sounded like. And look.
MC, make another hit. Whoa. This ain't what you want. Project. This ain't what you want. This ain't what you want. 1600 block. I just wanna rock. I just wanna I just wanna rock. Body yada yada. Shorty got that body yada yada.
And that girl in the tie-dye, that's my daughter. And it's important to highlight this because there's far more Chez Vous than there are Dr. Simons. And what do I mean? There's Boys and Girls Club. There's roller rink skate. There's the park, right? Growing up, I had PAL, Police Athletic League, right? We should fund that because those are the spaces in the environment that we want youth to be in, because we know that pro-social engagement decreases anxiety, decreases depression, decreases substance use, right? So yes, I want to see more people like me in my role, but that's a very long time. but we can fund something and say, oh, well, let's extend the hours and give parents an opportunity. It's even why in the video of Mayor Wu, the location that we chose for announcing my role was a community nonprofit that does not do behavioral health, but they offer kids opportunity to learn how to play the piano and have a podcast, and they can have a drop-in center and just be who they are. And when you talk to the youth and you talk to the parents, they describe a sense of comfort and a sense of trust and a sense of joy, things that we want our patients to experience, not in a clinic. So I said, oh yeah, let's use Zoomix was the name of the organization, right? So what about jobs? Yeah, you gotta think outside the box, because youth that are engaged in employment, you can go to the study, decrease mental health challenges. So youth in Boston, if you're 14 to 18, you can work in any number of our departments. How many jobs? 7,000. There is no one clinic that I could have in one summer, in one academic year, where I'm likely going to see 7,000 kids. It's just not possible. However, I would love for 7,000 kids who are Boston residents, who are from underserved communities, to have opportunity. And so what's interesting, in my role, I got a phone call 3 Fridays ago. Dr. Simon, it's such and such from Youth Connect. Youth Connect is a behavioral health program that is kind of tethered to our police department, that youth who are enrolled in things that they shouldn't be get connected to Youth Connect. And she said, Dr. Simon, I got a kiddo who he wants to be a lifeguard. And we just need a work release, a physical. And I'm calling the clinic. We faxed it over, they haven't faxed it back. It's been 2 weeks. Interesting enough, because of my role, I talk at a lot of places. So I said, oh, hold on. Email, call. Hey, this is Dr. Simon. Oh, Dr. Simon, thank you so much for talking with us a month ago. Yeah, awesome. But I got a guy, Ryan. He's on the other line. He's gonna fax over a form. It's for a patient. They're in your clinic. Is that possible? Oh, Dr. Simon, of course it's possible. And say, hey, Ryan, call. And I made sure Ryan heard me talking to the person at the clinic. And that youth who, yes, was arrested for something is connected to Youth Connect. So yes, we're partnering with our police department because unfortunately, they're going to pick up people. And that youth who otherwise would not be enrolled in therapy, would not have an opportunity at employment, is both in therapy and employed after an arrest. It's not usual, but maybe we can make it that way. So I started with family and end with family because my dad, Deacon Montclair Simon, and he walked me down the aisle, always giving me lessons. And a month after my role, he sends me this letter. Baby K, peace be unto you and your household. As I reflect on your accomplishments for the past few years, I want to tell you how proud I am of you. Since you are in a new position, I beg you to always be nice to people you come in contact with. Be considerate. Do your work with transparency and keep your integrity until you go down to your grave. I've seen people losing all they worked for in their life for stupid things they do at their work. Love your children and your wife as you love yourself. The ego is always there. And the Lord, who knows the heart of all, will reward you. Montclair. So talked about who it is that I am and who I've always been as I've gone through training, and who it is that kind of guides my moral compass. And so I'd be remiss if I did not acknowledge that sometimes you can't plan any of this stuff. To do good work, sometimes in the morning, you have to get down on your knee and pray.
I want to know. I want to know. Who you really are. I want to know. I want to know. I want to know who you really are. Who you really are. Who you really are. Put a lot of labels on you. I want to see who you really are. Put a lot of experiences on you. But I want to see who you really are. I put my own hurt on you, but I want to see who you really are. Invade my beliefs about you. I want to see who you really are. In a new way, who you really are.
And I mention him because the systems that we're in and the work that we do, it can't just be us. And the communities that need us and the wait list, they always have him. So I am Dr. Simon, Chief Behavioral Health Officer of the City of Boston. But as you just saw in that letter, some people still call me Baby K. Thank you.